Welcome back to Accent Your Beauty. I'm Jackie Callan. This is Dr. Mark Berkowitz, and this is a good show. You're going to love this one because these are your questions. These are the questions that have come in to the doc and myself, either through Facebook, through texting, through emails, or just calling in the office and asking questions. So we're going to see how many we can get through, and if you have any other questions, you can always text Dr. Berkowitz.
You can always call the office, go to our website and fill out a form, and we're happy to answer questions for you. A lot of people find me also. There's a website called Real Self that you can write to me through that as well, and I'm ready and geared up, and hopefully I can answer your questions.
You always have the answers, so I'm going to get you started on these
All
questions.
Right.
Some are my friends, so you better answer them thoroughly because they're counting on you.
Okay.
So our first question tonight is, can cheek filler make the eye trough more obvious? In other words, when you fill the cheeks, can you get that area to actually look more sunken?
So the answer is, it should be just the opposite. So when you place cheek filler, the cheek is the foundation for the lower lid. And the reason that you get that sunken look to the lower lid over time is because the cheek deflates, and that pulls upon a ligament that's underneath the lower lid, and it causes what's called a tear trough. People don't like this word, but it's called a tear trough deformity.
Well, it's not really a deformity, but it kind of...
That's the medical jargon for it.
Okay.
But what it is basically the tear trough is that area that the tear would run down, if it, like a luge, if it would. And so if you refill the cheek, it should lift the cheek and decrease that tear trough.
If it's done properly.
If it's done properly. Now, everybody's anatomy could be different.
True.
And so some people, it could look as if it's become deeper.
Maybe it's just the shadows, the way the light hits.
I think it could be the shadow for this person, or maybe their cheek was lifted too high.
Right.
And all of a sudden, if it's too high, then it's like a shelf. And so that could make it look deeper.
Now, do you find that eyes, as we get older, underneath the eyes, it goes one way or the other?
It goes one way or the other.
It goes hollow and shallow and deep, or puffy with bags under the eye.
So puffiness, for the majority of people, it's quite interesting. The puffiness, if you look at their eyes 10 years back, 20 years back, they probably had that puffiness.
Is that a hereditary genetic thing?
But it was hidden by, again, their cheek being elevated. And so the cheek was the foundation for their lower lid, and as the cheek began to fall, you got this separation. And so now you're seeing lower lid, this indentation, and then this convexity. So it's concavity, convexity, and so it changes the way light hits upon the area. For others, you're correct. The fat, what calls atrophies. So the fat starts to dissolve or disappear. So they get this hollowness around the eye, and it skeletonizes the area. And we can use, if you have it, your own body fat and build that area up.
And that lasts the longest, correct?
Well, body fat is a live object. And so it takes on a blood supply, and so it can be very long lasting. Now, some people still metabolize even their own fat fast, and so it can go rapidly for some people, but that's rare. Most people, what I see at 3 months' time, I see at 3 years' time, and will be there forever. That doesn't mean they're not going to lose surrounding tissue or bony structure that may change things as well.
But whether you have sunken areas under or puffy, you still need to lift those cheeks up to get a youthful look.
For the majority of people, that's correct. I mean, usually the person who has a sunken lower lid, they've lost volume on their entire face. It's rare that it's just around the eyes themselves.
And is that gravity
so
that pulls our faces down?
So gravity pulls our faces down, but more important than that is actually there's a natural change as far as the structures underneath the skin. So while the skin may stretch, there's a loss of some of the fatty tissue.
And collagen.
The ligaments within the face itself stretch over time. but the ligaments in the face are attached to the skull, and the skull changes shape. And so by changing shape, it's not holding up. It's the foundation. It's not holding up.
I'm glad
those.
you mentioned that, because I watch a lot of these shows about forensic science and that, and they can even look at a skull of a person and determine their age and their gender.
Right. Without doing special testing.
Right.
They can take a
Just
look and they can
by-
see how the skull has changed. And then through other testing, they can say, okay, this skull's from 2,000 years ago. But as far as the age of the person, they can tell a lot just by the shape of the skull.
Interesting. All right. You did a good job on that
All right.
question. On to the next. Does NeoGraft work for women? So first explain what NeoGraft is.
So NeoGraft is a hair transplantation method. So many people know of the strip method. The strip method is where an incision is made, a strip of skin is removed and scalped from the back of the head, then it's sewn back together. And it works well, but it leaves a large scar, and that skin then, has to kind of be filleted in order to get the different grafts. What NeoGraft does, beautifully, one graft at a time, and a graft can have one hair follicle, two hair follicles, three hairs within it, four, and it's basically suctioned out. And that hair is viable and then goes to be transplanted to build a new hairline for a man or for a woman. And as a matter of fact, I would say close to 1 out of 6 or 1 out of 7 people who come to see me for hair transplants are women. In the past 2 weeks, half of my patients were women.
Really?
And
Half?
Half were women, 2 were sisters, and 1 was actually transgender, changing from a man to a woman. And so we see that even more commonly at this point in time.
Well, there's places I notice with women, not so much that the hair recedes, but just behind the hairline, it starts to thin out. You can see
It's
the
a different
scalp.
method, a different combination of hair loss. For most women, it's more diffuse hair loss, and so we see it throughout the entire scalp. And some people, it may not be best for them to have a hair transplant, because if it's so diffuse that they're thin from the donor area, it doesn't make sense to take from there. And then there are medical therapies that can be done. But women can have the NeoGraft procedure and do very well with
Well,
it.
I have a close friend who's going through that hair loss, whether it's hormonal, age-related, whatever, and she found a filler substance, like one of those sprays
Yep.
that fill in the area.
So there are fibers that can be
right,
used.
and
It's
it
like a
actually
little
looks-
shaker.
It looks pretty good.
And where the fiber sticks both to the scalp itself and to the surrounding hair. And so it makes it look thicker, and it's been used on evening news for years.
It's been used a lot more than people know.
That-
We just don't look that close at the top of people's heads. But
And the other thing that some people do is they actually tattoo, they micropigment into
they
their
tattoo
hair.
their actual scalp
They tattoo
so
their
that
scalp.
there's a darkness
So
reflecting.
there's a darkness reflecting, and so it gives the illusion of more hair without placing those fibers in.
Oh.
So
Well, the
that's,
only thing about the fibers is, I do know someone that uses the fibers and is a performer, because a lot of performers do. And in the middle of a set, it was so hot, and he was sweating so much
it started
that
dripping.
the sweat was dark colored. You could see the sweat was black sweat.
So there are better fibers out there that will hold on.
Yeah.
So it's just like mascara,
right, exactly.
So
but
you-
this
you-
wasn't a great look when you saw that perspiration.
Sweating black is not
It
all that
wasn't great. Okay, we solved that. All right, here's number 3. What are the current best non-surgical treatment options for sagging jowls? And we were talking about that before on a previous show. That's an area that affects men and women, but it's really bad when it's a woman and you have that turkey neck, that hanging skin.
So we just came from Thanksgiving, yeah, and nobody wants the
I
gobbler.
want to look like the turkey, right?
So it's really quite individualized as far as the non-surgical methods, because each person's neck is going to be a little bit different. So on an earlier show, I showed you a picture of somebody having the Y lift. So the Y lift is basically placing filler structurally into the face, not into the neck. And by lifting the sagging skin in the face, it can lift the neck too, and many people will get a beautiful change as far as the neck and jawline by placing filler in the upper face. So that's one option. Non-surgical as well, there are ways to tighten the skin using radio frequency. So thermage is a great procedure that can help to tighten skin for people. There's something called Venus Viva that can be used as well. Exilus, these are all radio frequency methods.
Are they painful?
So thermage, I've had myself, and you can go onto the website and see, thermage vibrates and cools at the same time. So thermage is actually at like close to, I think, 8 generations later since when I first brought it in probably 15 years ago. When it first came out, there were people who had discomfort. It's very unusual to have discomfort now with radio frequency. There's a procedure that's known called ultherapy. Ultherapy can be very uncomfortable where people need anesthesia along with it, and that's why I don't offer it. Because
I'm glad you said that. Yeah. There shouldn't be that much pain in being vain. You know, we want to look good, but you know, we don't want to torture ourselves.
So there are plenty of wonderful procedures that can be done that can be either pain-free or made so that they're very comfortable. So
what about lipo under that area? Because it's fatty deposits.
So you asked originally, I think, non-surgical, so I didn't even get that.
So that is
lipo
a surgical?
So that's a surgery, but what I do a procedure called a laser lift, and I use one of 2 different lasers depending on what I'm trying to change for you, where there's 3 tiny incisions. 1, 2, 3. And what I'm able to do with those incisions is, number 1, use a laser to melt the fatty tissue. Then I can do some liposuction in the area. And then I can turn the laser toward the muscle, the same muscle we tighten during a facelift. Now, it's not the same kind of tightening you'd see in a facelift, but you can get tightening within an area. Turn it toward the skin to tighten the skin as well for you. These are progressive procedures. So meaning you'll see the change the next day. As a matter of fact, I did a gentleman yesterday. He came in today. He looked in the mirror with his big smile because he said, Dr. Bird, you told me I'm not going to see the change for 6 months. I see it today. And yes,
and that was thermage?
No, that was the laser lift.
Okay.
That was the laser lift. And so these are progressive changes that some part you'll see immediately, but they'll keep improving. So with the laser, that I do in an operating room. There are no stitches. I actually don't use an anesthesiologist. I give you just some medicine you can take by mouth to help relax you. And there have been people who have done it without any medicine who actually drive themselves home afterwards too. So it really is individualized.
Well, let me ask you a question about that. Don't you think that people should start at a reasonably young age, the first time you start to see a little bit of a wiggle there? Because isn't it much harder when a woman comes into it 70 years old with the full waddle going on and all the lines?
So the earlier you visualize it, the earlier you say, I'd like to change it, that is the better time to achieve the result you're looking for. Not that we can't do it at later points.
But when you get to that point, don't you need a lower face lift to actually
Many
get rid
times
of
that's
it?
what you need. You need a lower face lift. And then again, a lower face lift means different things to the doctor as it may mean to the client. So that is a part of the education. A lower face lift on its own for some people may not be enough. Sometimes we have to do what's called cementoplasty, where we're removing a ellipse of skin in the area, tightening muscle, or platysmoplasty.
The platysma
right, the
muscle under there.
So the platysma is a muscle that is actually 2 parts.
Right.
So it starts in the area here, and then it drapes all the way out. And so that's the muscle we tighten during a facelift. And it can be tightened just from the area from the ears, but it can be tightened in the area here too by placing a stitch underneath the skin. And I actually do a special procedure where I use a stitch that's like a trampoline stitch, that there's no large incision. I use this stitch and I basically, like a corset, place it back and forth, the needle through the skin, through tiny incisions. No stitches are necessary to get a tightening that 5-10 years ago, the only way you can get that tightening was with a facelift.
What does that cost, that procedure?
So that costs around $4,500.
Okay. And how much downtime for that?
So the majority of my patients who have that procedure are really back to their activities within 3 days' time.
Wow.
Yeah.
Wow. I hope that answered that question. We did get into a little surgical, not just the non-surgical, but sometimes you need a little of both.
Sometimes you need a little of both.
Okay. This person says, Jackie, please ask the doctor if he can help me. I have an apparent facial asymmetry.
Okay.
What can possibly minimize it, and what would the cost be?
So I love these questions because, boy, I've got to see you, right? Without seeing the person,
Yeah.
it's near impossible to give an opinion.
Because there's so many different.
Because one person's asymmetry is another person's end result. They'd be thrilled to
Yeah,
have
you're
that.
right.
And so one person's asymmetry may take a syringe, or maybe just a little bit of Botox. Maybe the asymmetry is their brow sits a little bit high, and we can try to balance out their brows.
Well,
by
some people I know have one eye a little bigger than the other, or that opens a little wider,
Yeah.
or one side of their face, their mouth, when they smile, isn't quite even.
And it's natural to have some degree of asymmetry, and as we mature, that asymmetry increases for the majority of people. But beauty is symmetry.
Right.
And so if
There's
we
a
can,
formula to that.
right, so if we can create symmetry for someone, we're able to do it whether it be one syringe, one vial of Botox, one thermage procedure. It's impossible to say without seeing the person. And as far as the rates, it can be $50 to $15,000, depending on what we're trying to do.
That's a bit of a spread right there.
But without seeing the person, it's impossible to answer.
So I think they should make an appointment for a consultation, and then you can answer that much more specifically. I think we have time for one more before the break. And can you decrease the jaw angle with fillers?
Yes.
Decrease that angle.
Yes, so you can change contours and angles with filler. So properly placed filler, you can do beautiful things. So I would tell anybody who's watching, look at our Y-Lift show, which was the show right before, and you can see the beauty of changing angles with filler. And it can make a marked difference by using filler. We can change someone's face subtle enough that their friends will think, they just get back from vacation, they look more youthful. There's something that makes them look more approachable, maybe prettier. Something makes them look more handsome. And it could just be one syringe of filler or more, depending upon what we're trying to do. But you can change the angles, you can change the jawline.
Well, that's the magic that you do. And I've seen your work, and I think the beauty of your work is that it doesn't look overdone. You make people look natural. They look younger, but they look just more rested.
That's what everybody wants. They don't want the in-your-face double take of, what did she do?
Well, none of your patients look like that. We're going to be back in 2 minutes with a lot more questions from you. So stay tuned. We'll be right back.
I'll tell you what happened.
Yeah, Morty, I got the Szechuan sauce.
We're at C2E2 with the legendary Chris Claremont.
Greetings, my fellow geeks. My name is Jordan Trevelyan, and this is Get It to the Geeks.
We are here with David Yost, the original blue Power Ranger.
Nobody promised you when you bought the thing on PS4 that you could play it on Switch.
But your excuse is garbage.
I'm gonna pull out my crossbow.
All right, sweet chainmail armor. Let's see what you got.
I'm Jackie Callan, Dr. Mark Berkowitz.
We all accumulate so many products.
They probably dried out if I opened the jars.
You can't miss the team member with Medicare.
You're a critical part of the team.
Yeah.
But I don't eat the yolks. That's not really helping them diet, is it?
They're not getting anything out of it. It goes right through them.
With these relatively small steps, it becomes a lot easier over time to make major lifestyle changes.
Put your arms out if you want to. Whoa! Nice!
We're back with more of your questions. You've been really helpful sending in these questions, and I like to know some of these answers myself. So couple of these I slipped in, but don't say anything. Okay. So our next question for you is Kybella a good way to treat face fullness? And we talked about people who don't want to look too full. So what if you already are full?
So Kybella was FDA approved. It's known as deoxycholic acid for actually what's called submental fat, so the fat underneath the chin. So it's an injection that breaks down that fatty tissue over time. And for most people, they need more than one injection. They can get a little bit of swelling afterwards because it creates some inflammation as it's breaking down the fatty tissue. Even though it's FDA approved just for the submental area, it could be used other places. So it could be used other places, let's say on the face or on the body. So people who are going after small area like knee fat or bra fat.
Or what about like
it could be used in the
arms?
It could be used in the arms too. But so I like to use it on smaller areas because otherwise there are other procedures that can be done which may be more cost effective. But I think this person asked specifically in regard to the cheeks.
Exactly, they're saying
and so,
face fullness.
Yeah, so face fullness to bring it down. So a lot of people will have a procedure called buccal fat removal, which is the fat within the area here where we go through the mouth to remove that fat. When people come in and request that, I sit down with them and talk to them for a very long time. I think it's a mistake for the majority of people.
I know models do that.
Models do that to get that sunken look.
But it must hurt. Is that painful?
Well, it's done in the operating room. The area is frozen, and most people are comfortable during the procedure and after as well.
Eating afterwards, is that a problem for a couple days?
For a couple of days' time. But it's nothing terrible, soft foods. And I guess the models want to be a little bit thinner too.
I guess so. Will it come back, though? Can it come back?
That fat, when it's gone, is gone.
Like with lipo, once it's gone, it's gone.
But the thing is, you've got to think not just of today, and that's what I do with every procedure. I don't just think of today. I think of what it's going to look like 10, 15, 20 years from now. And so while you may like the look of that fat gone today, I've got to sometimes play bartender and say, no, you've got to stop now.
Well, later on, when that happens naturally and you've already removed some of it, you're going to look really gaunt.
Right. It can
You'll
look
terrible. Older.
And so can you use Kybella to reduce the fat? The answer is yes. But since Kybella is non-exact science, I can't tell you, number one, how much fat's going to be removed. Number two, the reason why I wouldn't want to do it is because there are muscles and nerves within that area that the inflammation can affect. And it can affect things like chewing afterwards. It can affect your smile.
Scratch that off your list,
and so
whoever asked
I wouldn't
that
be a
one.
fan of Kybella into the lower cheek area.
Got it. Another good question here. If I do Juvederm for my eye hollowness before I do a fully ablative laser of my whole face, will that laser affect the Juvederm that's already been put there?
Oh, so there are so many problems with this question. So first
There's
of
no
all,
yes or no, right?
So first of all, listen, every doctor has their palette of what they love to use, but Juvederm should not be used in the tear trough area. Why not? Because Juvederm is a filler that loves water. So it's beautiful for the lips because you want a luscious lip.
Mm-hmm.
But the skin of the lower lid is the thinnest skin in the body. And so if you're placing Juvederm within that area and it swells, it may actually make things look worse for you.
So you have more puffiness
You may have more puffiness. So I don't like Juvederm in that area. But let's say we use the proper filler. My favorite filler is one called Bellatero or Volbella within that area, or actually your own body fat can be used in that area too. So if we were to use the proper filler, can we resurface the area before or after? And the answer is yes and yes. You can do it either way because the filler is not going to be affected by how deep the laser is working. The filler is placed deeper than the laser.
Okay.
If I were to do anything though, my preference would be to do the laser first, get the result we need, and then determine, is filler even necessary in the tear trough? Because a lot of times by using the laser between the lower lid and cheek area, we can get a beautiful contour just from the laser tightening alone. That filler is not necessary.
How many different resurfacing options does a person have?
There's a lot of different options. And so the options really depend upon, most importantly, the time you have available.
The downtime.
Downtime. So we can go from a buff and shine, where there's not much downtime, but it's really a buff and shine. You're going to improve the skin. You're not going to tighten the skin.
Would that be a step above a hydrofacial?
It would be a step above a hydrofacial. That is correct.
But under a peel?
But under, well, it can be, depending on where we go, there are a lot of different peels. So peels too are a myriad of peels where you can go very light to very deep as well. And so I like the lighter peels. We're going a tangent a little bit, but I'm not a big fan of the deeper peels because the deeper peels can go deeper than you and I would like.
I've
and that
seen
can create
results.
a problem.
Yes,
And
bad results.
one of the peels called a phenol peel, which is a very deep peel, is actually cardiotoxic, so it can cause
That's
heart
a
problems.
chemical peel, correct?
That's a chemical peel. So with the laser, to get back to that, the laser, we can go as deep as you'd like. The deeper I go, the more of a change I can make. So one of my favorite lasers is called Renuvion, which I can make a beautiful change. I can turn back time 15 or 20 years, but I need 2 weeks of your life to achieve that. That's 2 weeks basically where I'm seeing you every day to make sure your skin is healing well. And then there are the buff and shine peels. So it depends on, again, what you're looking at.
Well, what's
your
the
time
difference time-wise between the 2 weeks for that and a complete facelift? How much downtime is a facelift?
So a facelift, most people are really ready to have makeup on and be seen by the world somewhere between 7 and 10 days time.
So this is more downtime.
This is more downtime. This is more downtime.
But are the results equal?
The results are beautiful. It can look, you're going to get 2 benefits out of it, actually almost 3. You're going to get improvement of the skin as far as tone is concerned. Diminishment of wrinkles along with that. Many people have the beautiful tightening that looks as if they've had a very natural facelift without having that skin incision at the same time. And it can also improve collagen, where it can make it look as if you've had more volume too. And that's why I like that Renuvion procedure quite a bit. But I need 2 weeks of your time. You have to be dedicated to come see me for the 2 weeks.
I'm serious, because that's about as serious as it gets. That's a commitment.
That's a commitment.
But if you can see ahead of those 2 weeks and picture how you're going to look, what does that cost, by the way?
So that runs around $7,500 all inclusive.
Which is less than a facelift.
A traditional facelift would run somewhere between $12,000 and $20,000.
Okay.
Yeah.
Speaking of wrinkles, now that we brought that up, how can I correct severe wrinkles on my cheekbone area? You know, you see those people who their skin gets very thin and crepey and wrinkly.
So resurfacing that we just spoke about can tighten the skin. A facelift can tighten that skin. But one of my favorite things is a filler. And one of my favorite fillers for going after that wrinkling that people get is to use their own body fat. And I do the all me procedure, all me meaning all me. And what it is, it's your body fat in your blood. And so your body fat, through a special process, is garnered with a tiny little incision. No stitches are necessary. I usually, for most people, even if they're thin, can get the fat from their back. And it's a procedure where the fat is then brought down, where we get something called the stromal vascular fracture. What is that?
I have no clue.
What is
so
that?
You're going to tell me.
So what it is are all of those potential cells. You may have heard of stem cells within bone marrow. Well, there's more of these potential cells per teaspoon in body fat than there is in bone marrow. And so that can be, along with your blood can be through a special process called PRP, or platelet-rich plasma, where you get the growth factor. When you combine the two, it can be injected into the skin to, number one, give back the volume, but number two, build collagen. And so it can be injected directly into those wrinkled lines, those areas that you not only want volume, but you want to decrease the waviness to the skin too, and it will make a beautiful change with your own material.
But when you have a lot of wrinkles, a lot of fine lines, you can't inject every single little line.
I can do it.
You can do it?
It's a lot of work, but I can do
Okay.
it. And then again, I can combine it with the resurfacing too at the same time.
So
and to
sometimes
get that
it
other
takes a
benefit.
combination, a little cocktail.
It's 1 + 1 + 1 doesn't equal 3. It can equal 7, 8, or 9 in regard to the changes it can make.
Okay, this one we were talking about before, again, the under eye area. Somebody said that they had under eye fillers and they got a kind of a bluish discoloration.
So that's known as the Tyndall effect. And the Tyndall effect is when the filler is showing through the skin. Many times it's due to the fact that the filler is placed too superficially, too close to the
So
skin.
the filler has a blue color to it?
So it's not that it has a blue color, it's just the way light hits off of it
Okay.
underneath the skin. And excuse me, and it creates this bluish discoloration and called the Tyndall effect. If the filler, number one, is placed closer to the bony orbit, so closer to that bone, it's less likely. If you use the correct filler, it's less likely. So again, you asked me about Juvederm earlier. Juvederm is more likely to show off that Tyndall effect, but Bellaterra and Volbella are less likely to show that off, and that's why I like those fillers. But even in the best circumstances, sometimes people get a little bit of a bluish hue to the area, and that usually is very light, and with makeup it can be covered, or a little bit of what's called hyaluronidase can be put into the area, and that actually can bring down that filler just a little bit to get rid of that reflection or that Tyndall effect.
So it doesn't last forever, and you can cover it with makeup,
You can
so
cover
it's
with-
not the worst thing in the world.
Correct.
But if you go to the right doctor and he uses
It's
the
much
correct
less likely-
filler,
yeah, correct.
it's not going to happen. And I think, again, I want to stress the fact that what you put under your eyes, which substance, which filler, is key to the results you're going to get.
It's not just the filler, it's the filler. So it's
Oh,
who's
okay.
filling you too.
Right, not the filler, but the filler. Well, I think for a lot of people, that question comes up a lot under the eye.
It does.
So is it more women or more men that come
Oh.
to you for under the eye?
So over the past few years, wow, I am seeing more men than ever, but it's still women are the majority.
And don't you feel that the men more often have the puffiness rather than the hollowness that women get?
No, it's about equal.
Equal,
It's
huh?
about equal. I mean, both the puffiness and the hollow. And I mean, this past week, so last Thanksgiving week, I injected as many men for tear trough as I did women.
Really?
Yeah.
Well, men are getting more vain by the day.
No,
And-
it's not vanity.
but it's a good
It's a
thing.
love of oneself that's important, because if you can't love
But
yourself,
vanity is a good thing.
when it's not used for evil.
That's right, when it's not used for evil. We all want to look beautiful. I'm just barely getting through these. We have so many more questions for you. So we'll be back in 2 minutes, and we got lots more.
Welcome back to Pop That Culture.
Bury the phone in the pet cemetery. It's got a cord. Welcome back to the Craig Folly Show. Our votes don't matter. And I always disagree.
Doing this show, I feel like I get like a little bit of time to chit chat with the man
Yeah.
that I fell in love with.
Oh.
Hello, folks. Welcome to the Greg Russell Movie Show.
Writer, producer, director. How did this whole thing come about for you?
Detroit. It's the home of some of the world's most talented artists. It's where techno and Motown were born. It's a city where you can experience raw, untamed rock and roll. I'm Ben Rose, and I'm inviting you to join me weekday afternoons from 4 to 5 for the Motor City Juke Joint. I'll have interviews with musicians, info on what's going on around town, and a playlist curated by me just for you. It's all right here on newradiomedia.com.
Do you want to see things like this?
Did you just say you died?
Well, I mean, technically.
Or maybe even something like this.
We'll do nothing but destroy your corpses and burn them all for my dogs.
Your dogs are gone.
And sometimes, a little of this.
We need to have a talk.
I take my axe and I smash it.
No!
And check out Podquesters, the show where we tackle ghoulish goblins, fiendish foes, and dangerous drakes.
Oh, like the singer?
No, the dragon creature. Anyways, Podquesters, Fridays, only on newradiomedia.com.
Thank you for all these questions. You're going to keep us here for hours and hours getting through them. But talking about Kybella, which we were a little while ago, a question just came in. You mentioned that sometimes there's swelling after Kybella. Somebody wants to know how long does the swelling and jiggling last after a treatment, typically?
So the jiggling, if you're getting, is due to that inflammation and the swelling, known as edema within that area. And for most people, it's 2 to 3 days. Very rarely it can be up to 2 weeks' time. And that's why, although I like Kybella, I prefer other procedures in order to improve the turkey gobbler, if you will, the neck area, because I think they're more cost effective. You can get it done and have a change from one treatment. So that's why I like my laser lift for the majority of people. And the other thing Kybella doesn't tighten skin. And most of the time, if you're going to remove fatty tissue within that area, you want to tighten skin too.
Isn't it interesting that a lot of the questions are about the eye area and the neck area? So those seem to be the problem areas that most people are asking about.
That's what people see in the mirror, and that's what they ask about.
Now this next question we sort of touched on, but not specifically.
Mm-hmm.
This girl says, I have one eyebrow that has always been noticeably higher than the other.
Mm-hmm.
Without having surgery, how could you fix that?
So, number 1, 2, and 3 is Botox, Botox, Botox. You first have to determine which one you like better. Do you like the higher one or the lower one? If you like the higher one better, then I can place Botox on the lower one to take the muscles that are pulling the lower one down, to release them to allow that lower one to elevate. If you like the lower one better,
right,
then I can go over to the higher one, place Botox in the muscle that's pulling it up, so that the muscles pulling it down are working better, and now we can bring that down. So we can balance things out. Now, it's not an exact science,
right,
so we need to optimize things, but we can get there.
Wouldn't you think most people would prefer the higher?
Most people do, unless it's Spock-like.
Right.
So it's very high.
Or at a bad angle.
At a bad angle. And so there are people who come to me that may have even had Botox elsewhere that end up with like Spock-type eyebrows. And
Not a great look.
What we can do is, place Botox and just a touch to change it for them. I can't tell you how many times I watch TV and I see on the news these Spock brows. I'm saying, who are they going to that lets them walk out with that kind of brow?
Especially when they go up at that angle and they look like a deer caught in the headlights. They look surprised.
Yeah, it shouldn't be. And listen, it can happen occasionally, but if it does, it's something that literally takes 3 seconds to make it go away.
But isn't some of that caused by a bad brow lift where they've actually lifted the brow?
But if somebody were to get a bad brow lift like that, even Botox should be able to relax that for them.
Well, that's good to know. So
Yeah.
you can reverse a bad brow lift.
You can reverse a bad brow lift.
Whew, that's good to know. All right, here's another one. I am very obese. Can I get liposuction just on my neck?
So, liposuction, number 1, is not for weight loss. I'm forgetting what this person's asking. Liposuction on anywhere on the body is not for weight loss, and many people aren't aware of that. They think, okay, I'm going to come in for liposuction. I'm going to lose 15, 20 pounds just from the procedure itself. And number 1, for your own safety, you cannot have more than a certain amount removed.
What's the maximum?
It's 4 liters.
Okay.
4 liters. And
at a time?
At a time. And 4 liters does have a good weight to it, but it doesn't mean you're going to step on the scale and 15, 20 pounds is going to be gone just from doing that. Then, as far as this person is asking, if they're going to be losing weight, let's say they're going to go on a diet or have something like the Obera balloon that we've spoken about to help them to lose weight, then they're better off waiting until they have weight loss before having a procedure like this. If they say, listen, doc, I've tried everything. I'm not going to diet. I'm just want to go after this area. This area, I'm looking in the mirror, and if you can make a change in that area, I'd be thrilled. Well, for them, it may be more of a debulking than a contouring, meaning removing some fatty tissue for them to help them to look better, maybe even helping them to breathe better at nighttime.
So not just lipo under there, but actually surgically tucking that neck back?
It could be, or it could be just removing the fatty tissue so they don't have that weight when they're going to sleep, because that weight can push down. There's something called sleep apnea that can occur too. And so it's possible, but I'm just going to say this is very individualized. I'd really would need to see the person, really get to know the person before I would offer them a procedure like that.
Another thing that you taught me, and you taught me well, is that lipo will remove fat permanently in an area.
Correct.
It won't come back there, but
Correct.
it will come back somewhere else.
Well,
so just getting liposuction is not the solution if you're going to continue eating like a pig and not exercising.
Well, let's say you're going to have liposuction on your abdomen, your stomach, your flanks. That doesn't necessarily mean that afterwards you can eat, and just eat and eat and eat. You will gain weight throughout the body. It's not like it's just going to come back to your big toe and you get a big fat toe because we've done the stomach for you. So if there were areas that you were more prone to gain weight, you'll still be more prone to gain weight within those areas. But the fat will come back throughout and not just, say, okay, this time I'm going to get his earlobe and fill it up with fat.
So basically, every treatment that you do, every procedure, you still encourage your patients to eat healthy, to work out, and have a healthy lifestyle.
For the best results, and smoking is one of the worst things you can do, of course, for your body, but for cosmetic surgery. It can make it that you don't heal as well, and that not only do you not heal as well, but it can make it that you go back to the way things were faster too, because there's less blood supply to these areas.
Well, anybody that still smokes, I don't get it, but that's a personal choice. All right, here's one for you, because I never heard of this.
Okay.
If I get Botox in my jawline, can it cause problems swallowing?
Okay, so in the jawline, you can have Botox. This person's probably talking more within the area right over here than over here. So you can basically thin down the face in doing it. I'm pretty sure, I can't say 100%, but Bethany Frankel, if you take a look at her pictures from 10 years ago and now, she has a thinning down of her jawline. I believe that's related to Botox, that's
really?
occurred for her.
Never heard of it there.
It's very popular in Asian countries like Korea, where there's more of a square face, to give Botox into the area here to thin down. But there's a second question, a second part to that question, which is, can it affect swallowing or even breathing? So Botox, it is possible it can affect those things, but when Botox affects those things, it's given in very high doses directly into the area. So there are people who have spasms, their neck contorts, and they have very high doses of Botox given directly into the neck. And it's given, not for cosmetic reasons at all. And there have been reports of these people having difficulty of swallowing afterwards. So again, it's not for cosmetic reasons. It's given in high doses and given in an area that we would not be injecting.
Another good question coming up. Your answers are very good tonight, I have to admit. Very good job. I'm having surgery in 3 days. I accidentally took a leave this morning. Will I have to postpone my surgery?
Okay. So a leave is a blood thinner. And so with any blood thinner, there's an increased chance of bleeding. With bleeding, depending upon the area, and she said in her jaw she's having it, then with bleeding you can get what's called a hematoma. Hematoma can lead to infection. And so that's the reason why we don't want you to be on blood thinners. Plus, it makes it more difficult for the doctor to perform procedures if there's a lot of bleeding as well.
I'll bet there's people that don't know that a leave is a blood thinner.
I'm sure. So the answer is, if this is my patient and she took one Aleve within 3 days, would I cancel her procedure? And the answer is no, I would not. As you say, there are people who end up taking things that, even though I give them this list,
they still take
that they still end up taking. And I know it as I'm performing the surgery, that they probably just took something that they should not have. If they're more, I'm worried more about somebody who's on a blood thinner like Coumadin or warfarin or Plavix that's there, because those make things even more difficult, not just during the procedure, but for the healing afterwards. But I would want to know that she took the Aleve. So it's good that, you know, she tells her doctor beforehand, but it's not a reason that I would cancel a procedure.
Okay. Is it okay to get Juvederm on the marionette lines when I had Botox a month ago?
There's no problem at all. So many times I'll do Botox the same day as filler, same day as resurfacing. There are times where it is best to wait, and so it depends upon the person. But there are people who travel to see me from hours away. They take flights to see me, and they can't just keep coming back. And so multiple procedures can be done simultaneously and done well.
Okay. Is it possible to inject 2 syringes of Juvederm in my lips at the same time?
Yes, but that's not my preference.
That's what I was going to put emphasis on. The Juvederm is not the filler of choice,
no.
right?
Juvederm is my preference for the lips.
I thought
because it takes on water.
Okay,
That's why I
what's
like
the other
Juvederm.
one that you said was good for lips?
So Volbella is very good for lips, and
that's-
Juvederm is very good for lips. I don't like them in the tear trough.
Okay.
But my preference is always to do actually 1 syringe at a time.
Okay.
I like to do 1 syringe, have you see the results, wait a month, and then if we need to optimize things, we can place a 2nd syringe. Just like the last question, there are people who travel to me who have maybe very thin lips that I have injected 2 syringes at one time for them. But my preference is always to do 1, see them back around a month later, and then we can always optimize things if need be.
Less is more.
Yeah, you can
Start out conservatively.
You can
and
always,
add.
add. You can always add more. You know, sometimes when you shoot for perfection, you can end up with worse. And so you're much better off to be conservative, go with a very natural look, and then we can always come back another day.
One more question before the break, and it kind of takes in everything we've been talking about, but can you take Tylenol before getting injections, like to cut the pain a little bit?
Yes, we can, no problem.
Okay.
That's not a blood thinner, you can use it right beforehand.
So you can take Tylenol ahead of time as well as afterwards.
That's correct.
But like you said, and you've explained it, and I've experienced it myself, most procedures you don't even need Tylenol.
No.
It's
But if
a
it makes you happy, that's fine.
But it's usually, it's like a quick little prick, a little mosquito bite, feeling like a little, and then nothing, and then you look beautiful.
That's it.
So they say no pain, no gain, and that's
You don't
certainly
need pain.
That's certainly the rule. And you have a very good hand. So when a doctor knows what he's doing and places everything in the right space, it's
my team and I would make you feel very comfortable. You know, a lot of times pain comes with apprehension, and so if you're comfortable, you're usually, you know, coming in and there's no apprehension, then things go quite smoothly.
100%. Part of the pain is the fear, the anticipation, and when you don't have that, it's a breeze. We'll be right back with our celebrity segment.
All right.
And we'll show you some really good work and some really bad work. We'll be right back.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on new radio media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
Welcome back to Who's Got Chutzpah. I'm your host, Rabbi Tzvi Jacobson. Andy, are you ready? Andy, what holiday is this associated with?
Oh boy, Sukkot?
I'm sorry, that's not the answer we were looking for. Whitney, for the win. Can you tell us which holiday is this?
I know. Shavuot.
No, I'm sorry. I've got the answer. Ta-da!
What?
My show, Let's Talk Torah, where we talk Torah, holidays, faith, and all the things that help us live our life. That's Let's Talk Torah. Thursdays at 3 p.m. on newradiomedia.com.
That's pretty good.
Okay, here comes a fun segment. We're going to look at some celebrities, see what they've done. Who's first?
Oh, so we saw the human Ken before, so this is the human Barbie.
Is that a real person?
That is a real person.
Oh my gosh. Okay.
So,
Get out.
brow lift. Yeah, brow lift, filler, lip filler, cheek filler. Her nose was operated on. She has contact lenses to give a fake look that may even be what's called a scleral lens to give a whitening of the eye as well.
She's young. She's a young girl.
She's a young girl.
Oh my gosh. Is
fur
that a
and
wig,
jawline.
do you think?
I think that's a wig.
It looks like a wig. I mean,
Yeah.
oh, her mother should be ashamed of herself. She is cute though, but
She
what do
was-
you think that cost, all that work?
$35,000.
I would say 50, but anyways,
Yeah.
too much. So who else do
Let's
we
see.
have coming up? Oh, she's beautiful both ways, but go ahead.
So, you know, you first of all, this is not fair because we're looking here at two different ages as well.
Correct.
So, you know, as far as looking, I think she's aged gracefully. I think the cheeks may have had filler to keep some of the youthfulness to it. Eyelids, it looks as if she had upper eyelid surgery, and it's not the way I would do it because I think they removed too much fat from her upper eyelids.
Is that why they look deep set?
Yeah.
They're
So
like
they-
sort of
yeah.
sunken in?
And I think, unfortunately, somebody talked her into lower lid surgery too, because that youthful fat would look different for her, and she can, you know, place some more filler into the lower lid, and that would give her a more youthful appearance. But listen, she looks good.
I think she looks beautiful. She has beautiful eyes, a nice smile. Doesn't look like she's done anything to her lips. It looks
No.
very natural. I give her an A. She looks good.
Looks good. Next one.
Oh my goodness.
All
Okay, I'll let you start with Miss Jenner.
So I first have to thank her because she really has changed the way many younger women and men look at themselves. She may have gone a little bit overboard, but I have more people coming in for lip filler than ever before because of her. And she, at one point, got rid of lip filler, and my understanding is then went back to lip filler. And I think lip filler was one of the first things that she did in order to emphasize some cosmetic procedures. And, you know, the other thing that's difficult here is we're looking at her in two different views, and she's a little bit older, but, you know, the straight-on view to the side view, so she had lip filler. It's hard for me to tell exactly what she did, but she did something about her nose.
Well, she's also had filler other places.
Well, I didn't get down.
We didn't
I
get there
down there
yet.
I'm
But
just saying
can't miss that.
above the neck for her, and you know, filler to the cheek area too. Her makeup is different as well. Okay, so going down below, she's had some fill. It more than likely in both areas, her chest as well as in her gluteal region.
Oh, well, you can see that her butt looks much more defined than the first picture.
She's much more shapely.
Well, she's
Now,
a Kardashian.
She's Kardashian, and you know, it's made her famous. It made her sister famous,
And it sent you more clients.
Yeah, and so, you know, if it makes you happy, but it's not.
Well, she's awfully young to have
She's
started.
young to have done all
so
these
much
things.
surgery. What's your typical age of patients? Do you get girls that come in their teens?
So no, we don't get girls in their teens. Probably the younger women are in their early 20s for two things as far as filler. One is lips, and the second,
Botox?
no, the second is actually filler in the nose. They're not ready for surgery, but we can change the shape of their nose.
Filler in the nose.
Yeah.
Now we have to do a show on filler in the nose.
So we can get rid of some of the bumps within the nose. We can turn up the nose a little bit too if there's a downturn to it. And Botox is probably third in the things that they come in for because they want to be preventive.
Right.
And so I thank the Kardashians.
Well, for a lot of things. They've brought attention to beauty, youthfulness, and what you can do to keep looking good. Do we have someone else that we can look at?
I believe we do.
Oh, dear.
So, rugged looking, nice looking. This is Mickey, right?
Mickey Rourke.
Mickey Rourke. So,
I have a personal story. Mickey Rourke's a friend of mine, and he was a boxer. And at one time, I put him in the ring with one of my champions, James Toney. He told me afterwards that James fractured his cheekbone, and that's what caused him to have his first cosmetic surgery. And that was over 20 years ago.
Wow.
But since then, you can see how much more his eyes look, a lot smaller. And
so again, the misconception is if it's done in Beverly Hills, California, it has to be good?
Not necessarily.
Not necessarily. So, unfortunately, a very handsome man has changed dramatically. Now, as we get older, myself included, our ears get bigger, but his ears have been pulled down because this is a bad facelift.
Exactly.
And so he was tightened, and for some reason, even though gravity pulls down things this way, some doctors refuse to understand that, and they pull things this way.
I know, it should be
It
up,
doesn't make
not
sense.
sideways.
So he was pulled and made windswept, and then given filler in areas that men shouldn't necessarily have filler within the cheeks, and just, got rid of his rugged good looks and traded them in for.
He became the poster boy for bad surgery, unfortunately. God love Mickey. He's a great actor. Anyways, we'll be back next week with more information on cosmetic surgery. Dr. Mark Berkowitz will look at some more celebrities and analyze what they've had done. And you can look for us on newradiomedia.com.